This is WRBL News 3 Midday.
Cardiovascular disease is the #1 killer of women, causing 1 in 3 deaths each year. 1 in 4 men in the U.S. die from a cardiovascular event, such as a heart attack each year. Dr. David Markham of the Piedmont Heart Institute joins us now with some life-saving information we can all use. Welcome.
Thank you so much.
Great to have you. Let's talk about the signs of a heart attack, and are they different in men and women?
We usually say that the typical features in a man are what we all think of as chest pain and maybe radiation to the neck or the shoulder, maybe with some shortness of breath, this elephant sitting on the chest. But for women, it's important to have a high degree of suspicion if various other types of symptoms arise, as far as the suspicion of coronary artery disease or a heart attack. When in women, we think symptoms can be different in the way of having shortness of breath alone, or abdominal pain, or pain in the back, pain in the shoulders. Sometimes it's just nausea and vomiting and the stomach upset, these types of things. So we usually ask women to have a high degree of suspicion and to seek care if we have any of those unusual sorts of findings. And we also ask our providers to have a high degree of suspicion of thinking, in women, this may be a heart attack, and to get EKGs and do a workup for patients having this type of problem.
But a woman could have chest pains?
Yes, it's still the predominant finding of having chest pain, but in about 30 or 40% of women, the symptoms may be different than what are described as an elephant sitting on the chest, or pain on exertion. You know, so a lot of people describe angina as, when I do something, I have pain on exertion. But a heart attack can be crushing chest pain with unusual radiation or other type of symptoms in women compared to men.
Every time I have chest pains, I immediately go there. But let's talk about what we can do to reduce our risk of heart disease in the first place.
So for women, it's important to say that after menopause, the risk rises. This is due to hormonal changes in women. There's not a lot we can do about menopause, as far as changing that life event. But the things we do look at are healthy living, like eating right, low cholesterol, low fat diet, eating a balanced diet of fresh vegetables and low carbs and those sorts of things. The main things we also look at are not smoking or cutting back smoking. That's one of our main risk factors for coronary artery disease. Also treating high blood pressure, diabetes, watching your cholesterol, healthy diet and exercise. So staying active and treating overweight status is very important. And some people just have genetic abnormalities or a propensity in their family, and those patients should definitely be screened and know about that as far as their family history, so they can seek that care from their provider. And it goes back to working on all the things that we just talked about: cholesterol, diabetes, smoking, and lifestyle issues.
All right, Dr. David Markham, we have run out of time. We thank you so much.